Substance abuse and its impact on the brain. In this, we're going to go over what is substance abuse, the prevalence rates of substance abuse, prevention and early intervention, the signs and symptoms that are notable, the etiology from the standpoint of the brain, as in what aspects of the brain is affected and why, specific parts of the brain affected, and the treatment and treatment effectiveness. What is substance abuse? Substance abuse is defined as an overindulgence or dependence on an addictive substance, be it nicotine, alcohol, or opiates. Commercy and Schrebel say that substance abuse should be viewed as a medical condition and is often referred to as a brain disease. Prevalence of substance abuse. The prevalence that I looked at is mainly focused substance abuse in the USA. And according to the director of the Closing the Addiction Treatment Gap, the CATG, Dr. Taylor, in 2010 writes that as of 2010, more than 23 million Americans are addicted to alcohol and or other drugs. According to the National Institute on Drug Abuse, more than $740 billion is spent annually in costs as a result of drug abuse. This is based on the crime and the cost for the crime committed, whether it be imprisonment, the attorney fees, lost wages, whether they're on welfare, Medicaid, productivity, and healthcare. How much does it cost in the healthcare industry to treat individuals with substance abuse disorder? Prevention and early intervention. Researchers say that reports that prevention and early intervention is the key to minimizing substance abuse in today's society. How is this accomplished? By targeting elementary school, middle school children by emphasizing drug prevention education at an early age, behavioral wellness, family communication, doctor-patient discussion and assessment, referrals to effective treatment facilities. It's important to note that all treatment facilities are not good or effective treatment facilities based on their modality, whether they're using medication, therapy, or any other form of treatment. Why is substance abuse considered abuse? Researchers believe that addictive drugs activate the brain's reward system by increasing the release of dopamine. Dopamine is a neurochemical in the brain that is normally released after a pleasurable experience. For some, it's exercising, eating, sexual activities, laughing, anything that brings pleasure. It's normally as a result of dopamine being released. How does substance abuse affect the brain? Well, drugs are chemicals that can affect the brain by accessing its communication system, and it interferes with the way these neurons normally send, receive, and process information. It is important to note that in the brain, all these informations are sent via neurochemicals. If these are interrupted, then what needs to be sent out is either skewed, not sent, or the receptors are blocked and the message is not received by the brain. What are some of the medical consequences as a result of substance abuse? Well, the DSM-4 drug use disorders are associated with increased risk of suicidality. When you're drunk, you're not able to think clearly. When you're high, you're not able to think clearly. Sometimes everything that is bad looks worse, and so you may want to end your life. There are neuropsychological deficits because the drugs are interrupting your regular brain function. There is diminished quality of life in that addiction is pricey. Substance abuse is a very pricey problem to have as far as buying alcohol, cigarettes, and actually getting the drugs themselves. And also there can be infectious diseases such as HIV based off of needle transfer or not being mentally aware of who the sex you're having sexual activity with without proper protection. And then hepatitis, which is caused by damage to your liver. and is seen mostly in alcoholics. So I've broken down the medical consequences of substance abuse in 3 categories: alcohol, injection drug use, and cocaine, and how that damages the body on a whole. For alcohol, you have damage to your gastrointestinal systems, your cardiovascular system, your hematological systems, your gynecological systems. There are metabolic symptoms. Your CNS is also damaged, and you sometimes suffer from physical trauma. For injection drug use, there's sometimes soft tissue injection from the injection site where you're injecting the drug to your system. Because of the infection, there's sometimes fever, endocarditis, which is an infection of the heart lining, pulmonary symptoms, hepatitis, STDs, renal diseases, and withdrawal. In some cases, I know specifically alcohol, if the withdrawal symptoms are bad enough, the detox can cause death. And finally, in cocaine substance abuse, there's normally issues with the cardiac system, the neurological system, the pulmonary system, and HIV. The brain's role in the investigation of drug addiction. Now, nowadays, based on technological advancements, researchers are able to better study the mechanism of action of how substance abuse directly impacts the brain. 2 ways they do this is with magnetic resonance imaging, or also known as MRI, and the positron emission tomography, PET. These 2 allows researchers to look at the brain, and compare it to a healthy brain, as in someone who is not inflicted with substance abuse, and those who are, so they can somehow see the difference. It also allows researchers to look at those who are suffering from substance abuse in addition to other mental illness and compare the 2. The brain's role in the investigation of drug addiction. The CG, or the anterior cingulate gyrus, and the lateral orbital frontal cortex, or the OFC, which is normally referred to, are normally disrupted, specifically the dopamine mediator receptors. As mentioned earlier, the dopamine is the pleasure drug of the brain. It is a naturally occurring neurotransmitter in the brain, and a lot of time these substances causes an increase and over time a decrease in dopamine. There are also noted frontal abnormalities that are manifested in the dorsolateral prefrontal cortex and affects executive control of the brain. What are some of the treatments available? There's a lot of argument over the type of treatments that are used for substance abuse and whether they can be effective or not. Some researchers believe that the treatment for substance abuse can be effective with the use of long-term treatment and short-term therapy to address any underlying cause of the substance abuse, such as depression or chronic illness in the case of if they contracted an STD or hepatitis. Successful substance abuse treatment generally involves multiple steps. There's normally a detoxification process, one in which the body has to expel all traces of the drug from the system. This is normally the most dangerous, and this is the most harrowing experience because you never know what is going to happen during detoxification. There's also behavioral counseling, teaching the individual how not to be dependent on the drug by addressing what caused the dependence in the first place. There are medication that's used during treatment for detox and to help to cut back on substance abuse. There's evaluation and treatment for co-occurring mental health issues such as depression and anxiety, which these 2 sometimes lead to the substance abuse. And of course, there's long-term follow-up in order to prevent a relapse. Substance abuse can be effective Treatment of substance abuse can be effective with the use of long-term treatment and short-term therapy to address any of the underlying causes of the substance abuse, such as depression or chronic illness. The use of the Addiction Severity Index. The Addiction Severity Index, or the ASI, is an assessment used for individuals who are coming into a treatment facility to assess the level of addiction. And in this case, for those coming in, especially with alcohol dependence, they need to be extremely truthful because, as mentioned earlier, detox of alcohol can cause death if the amount of alcohol consumed daily is not properly addressed, or if the individual lies as to exactly how much alcohol they have been consuming on a regular basis. For the ASI, it is also a good index to use because it also includes a section for the individual to provide information involving a family history of alcohol addiction or drug addiction, and also there's a family history of mental illness, because this helps the treatment facility to see exactly what this individual is going through and whether the family history plays a role in the individual's current abuse. There are pharmacological treatment modalities used in substance abuse. The most common is nicotine, and that's for those who are going through smoking cessation. Nicotine comes in different forms. There's the patch, there's the gum, now there's the smokeless cigarettes, the e-cigs that has a very low dose of nicotine, in some cases no dose at all. There are other drugs, naltrexone, composite, and disulfiram are effective for reducing alcohol consumption. And then for opiate disorders or opiate use, methadone and buprenorphine is used. The one that is most commonly used is methadone because A, it is the most cost effective, and B, it has been around the longest and has been used and has a proven show that it is effective in opiate use. Chronic dependence on alcohol can result in periods of severe withdrawal syndromes, and this is reflected in an increased heart rate, high blood pressure, anxiety, seizures, severe cases of delirium, and even death, as mentioned earlier. Medications used are benzodiazepines that act as a gamma aminobutyric acid at the GABA A receptors in the brain to stimulate the release of GABA. GABA, or GABA, is a neurotransmitter that is responsible for decreasing activity throughout the nervous system. For opioid disorder, they normally use what are called agonist therapies. These are methadone, buprenorphine, and naltrexone. Sometimes there are combination therapies that are used, where based on the specificity of each of the pharmacological intervention, for example, each drug that is given, sometimes they need to be used in a combination with other treatments in order to have an effectiveness. For example, in some cases they use naltrexone with buprenorphine because of the cost of each medication and the frequency each medication is given. There are times when they use methadone and have to use an anti-anxiety based on the side effects. Some treatment facilities have found that using medication in conjunction with counseling, psychoeducation, or even comprehensive behavioral treatment helps in reducing the possibility of relapse. Future treatment. At present, there are no FDA-approved medications to treat cocaine addiction, methamphetamine addiction, and cannabis dependence, or marijuana dependence. Although they have been used in anti-anxiety medication to be helpful in reducing the effect of marijuana dependence.